Okay, we're back with number 19. We're going to go ahead and be rinsing this soon. We give it about a minute on there with our porcelain conditioner. And then we'll be rinsing, and then I'm going to go ahead and add silane to that. Rinse that thoroughly. I think the key here is to make sure that the crown is secure so that it doesn't move. It's not only does it secure, but it's also the abutment and the hex attachment is secure. So when I go to bond this in place, I'm going to make sure that the hex is engaged properly. Okay, so now we get to dry that up. I'm going to use an air syringe. There's absolutely no water coming in here. You'll see a little chalkiness. That means we got our bond. Add the silane. Silane's added. We're done. Next step. Nope. We're going to add 3M. I'm going to tip you back a little bit. Okay. All right. This is our bonding agent. And just need a thin film of that. Get that back. And we'll suction now. And we're going to add our composite to that. We'll bond it first. Okay. Add our resin, more material. And see we have an identifiable color we can use. This is a little lighter than our own teeth, but so we can identify it. When we remove it, we're going to take all of it away. All set for more material. Transfer, please. No, transfer the instrument. Okay, so we're just kind of loading it up, just making it thick so that it does its job. We don't want it to undo while we're working, so we're just loading it on there very gently. And just spread it a little bit. Visor seal. What's that? And we just smooth a little bit of that out. That's all we want to do. We'll take all that off in a minute. Let's make sure our molar is attached. So now I'm going to push down and cure it. So push down and cure so that it's engaged in the hex. All right, so retract here. And I'll push down and cure it. So now you don't have to worry about the abutment moving or having metal to metal rubbing against each other. You've got a sturdy situation. And now we can go about what we have to do. I'm kind of looking down a mine shaft, but we're used to doing that. We can see and I hopefully identify the top of the screw head. We will pre-soak with a tartar stain solution so that we can dissolve some of those little particles that are holding that screw in there. And if we can get it out of there with just a simple Explorer, great. I'm going to go ahead and rinse that now. We'll turn the light up. And voila, that is solid now. It's joined to her adjacent tooth. Perfect. Let's just go on in there now and let's remove that composite. So I'm going to go in and take the old filling out of it now, okay? All right, you okay? Everything good? I'm going to put a cotton roll in there and then you can lean on that. So far, so good. Great. So, occasional air if I need it. Okay, so you can see very quickly how the composite came out, and now there's some Teflon tape in there. Teflon is now in there, so we're going to remove that. I'll need a long explorer. I'll just use a small end of the long explorer. And we'll pull that right out of there, like so. There it is. Voila. So we have a very shallow access hole, which is nice. It's nice I don't have to go all the way down there. Now, what's inside? Well, it is an old gold tight screw, but there's also composite. Scaler, please. So you got to get rid of that composite completely. Get it all out of there. Let's zoom in. See, there's a little remnants right there. That's going to get in the way. It's going to contaminate. So just get rid of that. Here it comes. All right. Now we get to see. Go ahead. You need to close. Go ahead. I'm sorry. Great. Okay, so there's our screw head. So what we're going to do is at least try to pre-soak that immediately. But before I do that, I'm going to look inside and just make sure I got all my little remnants of composite out of there. It looks like a big piece of composite came out, which is what I wanted to see. And now I'm back inside. I'm exploring the entire rim. I'm going to use a endodontic explorer. I can almost even use a small explorer just to feel the rim. There's the attempts that have been made, and it's completely, you can see the head of the screw is completely stripped out. So really amazing. To see that. Possibly an old square type, we don't know. My patient's doing a great job. She's keeping her mouth open beautifully for us. Looking good. Now we're going to pre-soak. And this is a material that you only want to use like a drop or two in there, because it works right away. If it is tartar and stain, and we want to bring a small suction tip in there just in case we need to use it right away. So I like to use Tipidilli. I think they're great. They're disposable. They work really well, something like this. So you gotta be just careful how much you're gonna put in place. Let's see if I can extrude a drop first. There we go. There's a drop. I'm gonna bring a drop in there. And we'll put a drop right there. Now, keep your eye on the drop, and you'll see if there are any bubbles. Now, if you get bubbles that come up, you're in good shape, because we know it's passing through the obstacle, right? It's getting through there. So give it a little bit. I'll put one more drop in there. There we go. All right, very cool. So you got 2 drops in there. Give it about 5-10 minutes. Let's take a good close look at that. Let's see if anything is dissolving. Sometimes we'll see the color go from clear to an opaque color. So now it's clear. And we're looking for little air bubbles too. Let's see if we get an air bubble come up. Nothing yet. One thing in this game, you just got to be patient, work through the system. It's probably what's holding, there it is. See, now there's movement. That's good. All right. Just saw something move. That's good. So You want it to penetrate, you want it to dissolve. If it is calculus holding that, it will dissolve away and we'll have a loose screw. So we haven't tested it yet. I haven't tested anything yet, so I'm just kind of stirring up the solution a little bit. And we may have to suction that out if she has to close. So I have that suction ready. Might have to get right in there, or I can put my thumb over it. Are you okay? Okay. So you don't want them to taste that. It's not good. Okay, very good. Our options here is to try to turn that screw head. See if it turns on its own. I mean, you've got a couple of places that you can grab a hold of the screw and see if it does turn. Internally, it looks like there's some notches in the screw itself, so you can maybe get an instrument and just see if that turns it freely. I don't see much changes occurring here, so I have to I can use an ultrasonic and just touch that with an instrument and use an ultrasonic. That's one of the things that we can do to get it to move. I can take a 35 inverted cone with a handle, go in and try to unscrew it that way. We can slot it. There's a method of slotting. Now you can see it's getting cloudy in there. Something's penetrating, right? That's pretty cloudy now. So we're getting some luck here. There's a piece of lint in there. Let's see that. All right, so I'm gonna document a little bit more. I'm just gonna be patient here. We'll shorten this footage up, come right back when the screw is loose, and then we'll roll right into how to replace it. All right, Dr. Cuomo here with the screw retrieval case. We'll pause here for next